Assalamualaikum. My name is Dr. Sohail. I'm Assistant Professor of Pulmonology and Age Care Medical College, Hyderabad, Head of Department of Pulmonology, Ross Institute of Medical Sciences. You all know that tuberculosis is an infectious disease, and it's sometimes, unfortunately, it's called the national disease of Pakistan. It's totally, you can say, in the first world, this disease has been eradicated. But you see the numbers in Pakistan, they are alarming. It's airborne mode of transmission, and earlier the vector is better to prevent this chain of infection transmission. So you see, you come across in the current practice, there's a lot of variation in radiology. Most of the times upper lobe is involved. These are the different manifestations of tuberculosis radiologically. Pakistan is one of the major infectious disease. Tuberculosis in Pakistan ranks 5th globally, and you see the numbers: 69,000 deaths per year. PGSB must be sitting over here with the COVID, 2-2 साल COVID का बड़ा नाम रहा, मीडिया में भी highlight करना. How many deaths COVID ने caused in Pakistan में? 30,000 deaths in 2 years. And Pakistan में tuberculosis every year is killing around 70,000 patients, which is 200 cases per day. It's a totally curable disease. It's unfortunate that हमारे senior professor भी बैठे हैं, teacher भी बैठे हैं. इस बारे में मैं सोचता हूँ कि इस पे इतनी क्यों नहीं, हालांकि WHO का भी इस पे रोल है, लेकिन ये eradicate क्यों नहीं हो रही है? फर्स्ट वर्ल्ड में जाएंगे तो tuberculosis totally almost eradicated, सिर्फ immunocompromise में रहती है. One of the reasons कि जो diagnosis में challenge आता है कि about 40% of the patients they don't have the sputum which is required to label the patient as tuberculosis, definitely tuberculosis case. This is the graph data from the last 10 years. You see trend is almost static. In the last 2020 and 2021 it was a bit less, perhaps due to the COVID pandemic. It was reported less, mass adherence से भी इसकी transmission में फर्क पड़ा. So what we did, targeted population था कि case with history है, TB contact की, या अगर नहीं भी है, लेकिन ये कि contact history patient के symptoms हैं और radiological findings हैं, so that those are the cases of presumed tuberculosis. But those patients who didn't have any sputum, so we gave them an option कि we go for a sputum induction before bronchoscopy. So this was basically the purpose of our study. 7% hypertonic saline we used it. This strength of saline usually it is not available in the market. We have to tell the pharmacist to prepare it specially. And what it does, it's osmotic in nature. It draws the fluids from the surrounding tissue, or the sputum becomes easy to extricate. And it was, if you follow it with the chest physiotherapy and targeted drainage of that lobe, you get the sputum in majority of the cases. So it was a prospective intervention study. It was done in the Abbas Institute of Medical Sciences, Hyderabad, and technique was to use hypertonic saline and sputum induction. We did sputum induction in 54 patients, and the sampling was convenient. And including criteria was patients who have presumed tuberculosis but they don't have enough sputum. And excluding criteria with patients who are already positive or had treated tuberculosis, was treated as tuberculosis case before, and patients who are dementic or non-cooperative. So this is a challenge I discussed with you. With the for the last 1 decade we have MTB gene expert, and it has high sensitivity and specificity. So, but the problem is to get enough sample for this test. And one patient can transmit this disease to 13 other patients before this patient being diagnosed and treated. So what are the options if you have a patient doesn't have the sputum? Either to do bronchoscopy or do the sputum induction. और तीसरा वो है कि जो हमारे GP या physician कार्य होते हैं कि उनके में and most of the time you see कि 3-4 दफा उन्होंने HPV फाइब्रोसिस चल रही है, प्योर मसला है, and patient 4-5 किलो हम रुकवा रहे होते हैं, HPV की दवाई छोड़ दें. तो ये दो ऑप्शन बीइंग पल्मोनोलॉजिस्ट हमारे पास, एक ऊपर वाली ऑप्शन तो अवेलेबल है, नीचे वाली ऑप्शन होपफुली के ये अवेलेबल हो जाएगी जिस तरह से हमने बताया। ब्रोंकोस्कोपी इसके एडवांटेजेस यू मस्ट ऑल बी फेमिलियर विद दिस के डे के प्रोसीजर है, हाई स्पेसिफिसिटी है, टॉपिकल एनेस्थीसिया चाहिए, सेडेशन टॉलरेबल बाय पेशेंट्स, और यू कैन डायरेक्टली टारगेट द अफेक्टेड लोब एंड सेट इट एज हाई यूज। डिसएडवांटेज क्या है, इन्वेजिव प्रोसीजर है, पेशेंट अनस्टेबल है, यू कांट डू इट, कंसेंट चाहिए, ट्रामा हो सकता है, एप्रीहेंशन होती है ऑब्वियसली जब वो कहते हैं कि आप यू पुट अ ट्यूब इन योर लंग्स, तो मोस्ट ऑफ द टाइम जो है ना पेशेंट हैव टेंशन, पॉसिबल अरिथमियाज विद द टॉपिकल लिग्नोकेन, इट्स क्वाइट एक्सपेंसिव, 15 to 20,000 इट कॉस्ट टू द पेशेंट एंड मॉर्बिडिटी मॉर्टेलिटी भी है इसके साथ। सो व्हाट इज स्पूटम इंडक्शन? Sputum induction hypertonic saline is basically irritant. So what we do, we nebulize the patient with the salbutamol, 1 cc for 5 to 7 minutes, and then we give around 20 cc of hypertonic saline and nebulize the patient for 10 minutes or 15 depending upon when patient starts building up the secretions. And that is followed by the postal drainage and chest physiotherapy. So what is the advantage of sputum induction? It's non-invasive, simple, it costs to the patient around 300 rupees. And 300, if you compare 300 to the 18,000, it's quite cost effective, simple, safe, it can be done in peripheries, anywhere, in the clinics, acceptable to the patients, it's repeatable and reproducible. Disadvantage tachycardia, bronchospasm, it causes significant bronchospasm. And it can cause the mixing of nasal and gastric secretions. So what we did, we pinched the nose during this procedure. So what we actually found that out of these 54 patients, 30 patients turned out to be positive for MTB genes, right? And when I searched the literature, it was quite high, surprisingly high. I am fortunate enough to have respiratory therapist in my ward. They actually put a lot of work in these cases, but like 55% success or yield is quite significant compared to the cost of the procedure. So when we compared with the other studies, I found few of the studies like they had positivity of around 18%. We are still continuing this procedure. We haven't published this paper yet. Like I want to have around 200 patients and then we can add. We didn't follow the culture because this is obviously NTP lab and they are not doing routinely now culture because some of the cost issues. We just used as an MTP gene expert as the standard method. So my conclusion is the patient's induction is, you should consider this option because it can be applied anywhere, even out of the specialist centers. And apart from this induction, we had a large number of patients with bronchiectasis, ABPA, who are struggling with their secretions. This hypertonic induction followed by the lavage. This is called bronchial lavage. It's quite miraculous for the patients. It gets the secretions out of the chest. I think I am done with it. Any questions? And within the time, I think the first speaker.